Dr. Bill.
That to me, because I didn't get one.
Thank you, Lions of Alabama. I also want to thank the Fairhope Lions Club and two guys named Joe for the nomination. I really cannot accept this award in my own name. The award really is about the Alabama Free Clinic, not about Bill Goetter. And it also is about all those who worked to start the clinic and all those who are working to continue the clinic now in 21 years of operation. My first thanks actually goes to my wife, Vivi. She's a nurse. She was in the initial stages of the development. She probably spent 4 hours for 1 hour I spent working. We had a coalition of business leaders and community leaders in Bay Minette. She organized the nursing services. She served as a board member for 10 years, and she still works with us in the fundraising. And after 10 years, we looked at each other and said, there shouldn't be two Goetters. A quick history of the clinic. In 1968, I was a medical student at Emory University. And Emory University's teaching hospital was Grady Memorial Hospital that is still operating today with the same mission. It serves it is operated by the Fulton DeKalb Hospital Authority. And if you're in that area and you need health care, you have no other access. There's excellent care, really supervised by two medical schools at that hospital. And then in 1971 in June, I left Grady Emory and went to Birmingham to the University of Alabama Hospitals and Clinics that later became UAB. And there, the 12th floor of the Jefferson Towers was dedicated to that same mission. And then in 1972, Mercy, which became Cooper Green, opened. And I stayed on the faculty there till 1988 when I moved to Fairhope. So for the first 20 years of my medical experience, there was always a home to take care of those who had no other access to care. When I arrived in Fairhope in '88, you go to Paradise and you find there's some problems. And I met really great doctors doing charity work. The problem was there's no way to make it comprehensive. You can have a large sample closet and somebody can come to you and you give them office samples. You cannot take care of diabetes, hypertension out of a sample closet. There were many, many barriers for trying to set up some kind of health clinic. And in fact, it took almost 4 years to work through the political, to work through the legal, and to work through the technical issues of setting up a clinic. Now, our really great partners have been and still are the Baldwin County Health Department. One of the biggest obstacles we had was a legal liability problem, and we went and we copied laws from the state of North Carolina and Virginia. And I really credit Vicki Bounds for helping us get with the legislature this law passed. And as soon as the law passed, and that was in '98, we opened the first clinic in Bay Minette. 5 years of development, it really felt like that you take a step forward, take a step backwards, to the left, to the right, and you find a new problem you didn't know about, you solve that problem, something else came up, and it was like a boiling cauldron of chaos, okay? But when you got to the end and you look backwards, clearly the hand of Providence guided the ship through all those rocky waters. There's no doubt. Today, 21 years later, we have 3 locations. We have clinic locations with the health department in Bay Minette and Robertsdale. We use a private physician's office in Gulf Shores. We have 20 volunteer physicians. Most of our physicians are actively practicing doctors. Okay, this is not a group of old people like me. It's a bunch of younger people that they're very vibrant and they're very modern. We have 15 volunteer nurses, and it goes on. Now, the first question you probably said, how big is this problem? I mean, here we have a health clinic. We all know we have people that are medically disadvantaged. And all I can tell you is all politics is local, and all I know about is Baldwin County. In Baldwin County, we have 30,000 uninsured adults. Okay? 86% of those are working. Okay? And those working people are paying taxes. And if you want to put a face on it, this suit that I'm wearing today, when it was picked up at the laundry, the lady there in that location has been our client for over 20 years. Okay? And then the clinic I did last month, and since you guys are really into vision and diabetes, I mean, diabetes is one of our biggest issues we deal with, because diabetes is very expensive, and diabetes is very deadly. There was a young woman I saw last month in clinic, and she showed up and she was wearing a very neat professional shirt and had the logo of a brand name hotel on it. And she's the lady, when you walk in and check in, she's the lady behind the counter. And she has diabetes, and she has no health insurance. A lot of these hotels are franchises. And you wonder why we have so many uninsured people in Baldwin County. We have a lot of hotels, we have a lot of hospitality. And if you look at people working in service stations, in convenience stores that are clerks, you can go to a very fancy store that's a privately owned store, and that clerk probably may or may not have health insurance. And the problem with not having health insurance in the 21st century is that the preventative diseases are expensive. It's not a matter of saying, well, I've got a good job, I can go pay for this stuff. I mean, it's costly. Now, of the 30,000 uninsured, based on national numbers, 46% of American adults have problems with blood pressure. About 15% have problems with diabetes. And if you do those numbers, I mean, that means, oops, I should have that up here. I mean, that means we probably have more than 14,000 uninsured adults with hypertension and about 4,500 with diabetes. And if you leave those conditions untreated, you end up having more visits to the emergency room with heart attack and stroke, which is very burdensome on society. The other real fact is, if you take these people out of society, our economy collapses. Our economy collapses. Okay, another fact. Medicaid in Alabama does not take care of poor people. I mean, Medicaid takes care of pregnant women, disabled, and children. Okay? So, the Affordable Care Act has been another kind of interesting thing. We've signed up a number of clients on the Affordable Care Act. And so they, for $1 a month, they have Blue Cross insurance. They have a $6,000 deductible for any procedures. They have co-pays for the medicines. They have co-pays for insurance for the doctor's offices. They come out with tears in their face saying, I can't afford it. I really thought 15 years ago I would live long enough to see this clinic closing, because the Medicaid expansion and the ACA would come together, giving universal coverage to those people who are working, and even those who are not working. In the newspaper press register on Friday, there was an article written by a gentleman, and he says that there are 340,000 working uninsured Alabamians. Okay? Well, by the way, there are 12 of the free clinics in the state. And so we're not the only act. We like to get all the Baldwin County people together and let's do some things together, because diabetes is important, vision is important. We actually have a retinal camera we're now looking for early diabetic eye disease. Now, from the Daphne Lions Club, to introduce Laurie Snyder, right there. She is the executive director of our clinic. She started as a volunteer in 2009. She became the clinical coordinator in 2010, and then she became the exec 2 years later, and now leads our effort. We'd like for you to join us in our effort of doing our mission and our work. I thank you for this opportunity to share with you what we're all about, and thank you for this award, which again I accept in the name of the clinic. Thank you.